Good evening, parents. Thank you for joining us tonight. Bienvenidos, padres. Gracias por estar con nosotros. Tonight, we want to have a town hall, and I'm so grateful to Dr. Erica Gonzalez, who's going to be with us to answer questions for parents about vaccines. Quiero decirle gracias a la doctora Erika González, que va a estar con nosotros, les va a dar una presentación y también va a tener, va a tomar preguntas sobre las vacunas de COVID. We'll also have Ms. Toni Thompson, also, who's been leading our efforts here in our district, both around COVID testing and around vaccines. También vamos a tener la señora Toni Thompson también, que es la líder de aquí del distrito que está trabajando con nosotros con vacunas y también con exámenes de COVID. So let's just start our presentation. So first of all, as you can see, we have had a strategy all along around our strong protocols, having COVID testing at every one of our schools. And now we're excited that we have now been aggressive in starting vaccinations. Para nuestros padres pueden ver que nosotros hemos todo este año tenemos muchas reglas implementadas para que todas nuestras escuelas estén seguras. Y también tenemos exámenes de COVID en todas nuestras escuelas para todos nuestros estudiantes y todos nuestros empleados. Y ahora estamos empezando también a ayudar a la comunidad con vacunas. Next slide, please. Right now, when you look at what we've done so far, we've done over 172,000 COVID tests, and our positivity rate has been under 1%. In fact, it's been averaging 0.5%. And recently, we're at 0.1%. And what's exciting is that we have now helped over 5,500 student staff, and we're starting to do some students and partners getting vaccinated. Lo que me da mucho orgullo es que con todos los exámenes que hemos hecho en nuestras escuelas de COVID, más de 162,000, el porcentaje positivo ha sido menos de 1%. Puede ver que es mitad de 1%. Y estas últimas semanas hasta un porcentaje hasta más bajo. Y lo que me da orgullo es que hemos ayudado a más de 5,500 empleados y ahora estamos empezando con estudiantes y también con nuestros partners para recibir las vacunas de COVID. Y ahora quiero la señora Thompson va a presentar más información. Ms. Thompson?
Thank you, Mr. Martinez. In addition to, again, our strong safety protocols and our aggressive and consistent testing, we have delved in very deeply to the vaccination project, and we've been providing numerous opportunities for employees and now even for students to get the COVID-19 vaccine. So the offer is now eligible to students and their family members to get the vaccine, and eligibility currently is for ages 16, 17, and 18 or older for the Pfizer. And if at some point in time we're offering the Moderna or the Johnson & Johnson, then it would be eligible for students who are 18 years or older. Our priority has been high school seniors because we know that they're preparing to graduate. And we want to make sure that not only they've had an opportunity to get the COVID vaccine, but they've also had an opportunity to get the meningitis shot. So, but now all eligible high school students, regardless of whether they're sophomores, 16-year-old sophomores, juniors or seniors, are eligible. And if we have some 16-year-old that are ending their freshman year, then they would be eligible as well. We'll work to secure opportunities for younger children, ages 12 and older, when a vaccine is approved for that age group, and we're optimistic that that will be available in the very near future. Next. So this week, we're going to extend to you the opportunity to actually get your high school student vaccinated on Thursday here at the Alamo Convocation Center, which is adjacent to Alamo Stadium, between the hours of noon and 6 p.m. Not only can students get the vaccine, but family members, parents, or other family members who are eligible, who are 16 years or older, can also receive the vaccine. If a 16 or 17-year-old is registered, then we ask that either a legal guardian accompany the student, or that you fill out a consent form in advance. And we're going to make that information available to you through the high school principals by tomorrow morning. And certainly if you have questions, we welcome those and direct them to your high school principal or another campus administrator so that we can respond to you timely. We'll hope that you can respond and register if you're interested no later than noon on Wednesday of this week so that we're prepared for this big event on Thursday, which is actually going to be sponsored by STAMP, which is South Texas Allergy and Asthma Medical Professionals. And again, Dr. Gonzalez, who's going to speak with you shortly, is the CEO for that clinic. There will be another opportunity offered next Wednesday at the old Pfeiffer Elementary by a component of the Alamo Colleges, and we'll send information about that soon. And then I was excited to learn this afternoon that University Health will continue to offer opportunities for students, eligible students, and family members to receive the vaccine as well at Wonderland of the Americas. So more information will be forthcoming about that clinic, and we'll send that information out later this week because we'll start scheduling students for the Wonderland clinics next week. And the other thing that I want to point out, particularly for parents who have seniors, is that we will be thoughtful about how the COVID-19 vaccine and meningitis shots are scheduled so that they don't overlap, because there needs to be a two-week span between receiving any of those vaccines. But we'll be thoughtful about that, and your seniors would still be able to get the meningitis shot as late as June before they graduate.
Gracias, Ms. Thompson. Lo que estaba ahorita discutiendo la señora Thompson es que vamos a tener vacunas esta semana. If you can bring up that slide, Mario. The last slide. Perfect. Vamos a tener vacunas este jueves en el Alamo Convocation Center de 12 a 6 y son para estudiantes que tienen 16, 17 o 18 años. Y también vamos a poder ayudar a los padres también, y también vamos a tener vacunas el miércoles, el mayo 5, de 9 a 12 en el Pfeiffer Elementary, y pueden ver el domicilio. Y luego también esta semana que viene también vamos a poder dar vacunas con University Health. Para que reciban más información, por favor, trabajen con sus directores de nuestros high schools. Estamos inscribiendo a todos nuestros niños que quieren tener vacunas, y también estamos ayudando también a los padres o personas de la familia que también quieren recibir vacunas. Así que por favor, infórmense, trabajen con nuestras escuelas, y para nuestros niños que están graduando también vamos a ofrecer en el futuro vacunas para meningitis, que es algo que es un requisito para los estudiantes que van a entrar al colegio este año que viene. Así que para nuestra comunidad quiero que sepan que nosotros estamos con ustedes para ayudarles para recibir sus vacunas. Y ahora vamos a tener la doctora Erika González, que es una expertista en lo que está pasando ahorita con COVID y las vacunas.
We can have the first slide up. Good afternoon. It's good to be here with you guys today. I want to thank Superintendent Martinez and Tony for their partnership in this very important initiative as we try to get as many people in the community vaccinated. As was stated, I'm Erica Gonzalez. I'm the CEO of Stamp Allergy, and I have my colleague, Dr. Raul Rubio, here with me, who will be translating in Spanish and taking any questions that we have in Spanish, so that way we can make sure that the whole community is able to understand us. Buenas tardes, soy la doctora González. Le quiero dar las gracias al Superintendent Martínez y a Tony por estar aquí con nosotros, dejándonos tener la oportunidad de poder darle la vacuna a la comunidad. Y conmigo tengo a mi socio, el doctor Raúl Rubio, que va a estar hablando sobre la vacuna también y ayudando con cualquier pregunta que tiene la comunidad en español para que se pueda entender toda la comunidad. We can have the first slide, please. So before we get to the Johnson & Johnson, as most of you know, there's 3 vaccines that are currently available in the US for administration. We have the Pfizer vaccine and the Moderna vaccine. Those two vaccines were first given authorization to be used here in the United States in December. And the Johnson & Johnson got emergency use authorized in February of this year. Since that time, we have vaccinated 7 million people with the Johnson & Johnson vaccine. And there had been 6 reported cases of cerebral venous thrombosis, which is clots to the head. And because of that, they had to put a temporary pause just so that they could look at the actual risk. The people that were getting the blood clots to the head, the actual percentage was no greater than what it would be in the general population. But anytime we have a new medication coming out on the market, if there's anything that seems like might be associated with it, things need to be put on pause. And then the information needs to be looked at again to make sure that it is safe for the community. As of this past Friday, the FDA has once again given the green light. So Johnson & Johnson is back on the market for administration. However, for the events that we will be having, we will be doing the Pfizer vaccine.
Antes de iniciar, es importante mencionar que vamos a tener 3 vacunas disponibles. Estas vacunas son Pfizer, Moderna y Johnson & Johnson. Las vacunas de Pfizer y Moderna estuvieron aprobadas por la FDA a partir de diciembre y la de Johnson & Johnson fue un poco después aprobada. Hace poco tiempo hubo una pausa debido a 6 casos que se presentaron con esta última vacuna, que fue Johnson & Johnson. Ya la FDA y el equivalente de la FDA en Europa dieron la autorización para continuar con las vacunas. Estos casos fueron una trombosis cerebral venosa, que significa coágulos en el cerebro, y dada esta razón, la vacunación se hará únicamente con la vacuna de Pfizer el próximo jueves.
Thank you. Next slide. So when you look at Pfizer and Moderna, it's important to know that both of them are equally effective. With the original studies that came out, it showed that it was 95% effective with the original strain of coronavirus. As you guys know, there's been some variants of the coronavirus that have already been seen here in San Antonio. The studies showed that both of these vaccines are still very effective against these variants. I think what's very important to note is that although the vaccines are effective against us being infected by the virus, more importantly, if you are infected, they are highly protective, almost 100% protective against death against the COVID infection, which is really what the goal is here, is to make sure that we're keeping people healthy. Pfizer and Moderna are both 2 shots, so you have to get 2 doses of the vaccine. The Pfizer is given 21 days apart, while the Moderna is given 28 days apart.
Cuando vemos una comparación entre las 2 vacunas disponibles, que son Pfizer y Moderna, es importante mencionar que aunque ambas tienen el 92 y 94% de efectividad y ambas son dadas en una doble dosis, una 21 días después y la otra 30 días después o 28 días después, lo más importante es que ambas han demostrado que una vez que te pones la vacuna, sin importar cuál de estas sea, tienes protección y los casos no se complican y reducen la hospitalización de ambos casos.
Next slide, please. Now, both vaccines are what we call messenger RNA vaccines. And all this means is that when we administer the vaccine, and the vaccine is administered in the arm intramuscularly, we are injecting a small piece of mRNA from the virus. What the mRNA is basically the instructions on how to make the spike protein from the virus. So the spike protein is what surrounds the virus itself. So that enables the body to recognize the coronavirus enough to where it'll make antibodies against it so that you are protected. But the good thing about the messenger RNA vaccines are that you, because you're not getting the full vaccine, there is no risk of you actually getting coronavirus from the vaccine. In addition, a lot of people ask, if I get the vaccine, am I able to transmit the virus to somebody else? The answer to that is no. If you are vaccinated and you go home, there is no risk of you actually transmitting that to anybody else in your household. And also another question that people ask is if it changes your DNA. But this vaccine does not enter the nucleus, which is the middle part of the cell where the DNA lies. So it doesn't have any interaction with DNA in your system.
La tecnología que utilizan estas dos vacunas es conocido como el RNA mensajero. Este RNA mensajero son las instrucciones que se utilizan para que el sistema inmune del cuerpo pueda crear los anticuerpos en contra de la espiga o de la punta de la corona. De esta manera, el cuerpo aprende a luchar en contra del virus. Las dos preguntas más comunes en cuanto a esta tecnología es, ¿puede ser que una vez que yo reciba la vacuna infecte a la gente que vive conmigo en mi casa? Y la respuesta es no, porque, como se mencionó previamente, este RNA mensajero no es el mismo del virus. Es solamente una parte del virus que le enseña al cuerpo cómo luchar en contra del COVID. Y la segunda pregunta era si este RNA mensajero puede modificar el DNA. Y la respuesta también a eso es no. El DNA se encuentra en la parte central de la célula, dentro del núcleo, y la vacuna nunca tiene acceso a esta porción. Entonces no hay riesgo de modificar el DNA. La vacuna se da en el brazo de manera intramuscular, ambas dosis.
Next slide, please. It's also important for people to know that this technology that was used on the vaccines is not anything that is new. We've been using this type of technology for over 30 years on different types of vaccines. So it's not something that we are unfamiliar with and that we don't know whether it's safe. It's a safe technology, it's an effective technology. And in fact, the development of vaccine towards the coronaviruses had been started a while back, but had not been completed. But of course, when this became a worldwide pandemic and a worldwide emergency, the funding went into being able to make sure that we could expedite the development of this technology specifically against the coronavirus.
Es importante mencionar que la tecnología que se está utilizando para estas dos vacunas no es una tecnología nueva ni que se hizo en el último año, sino que es una tecnología que se ha estado trabajando, investigando durante los últimos 30 años, y es una tecnología que es completamente segura. Dada la pandemia actual, en el último año se produjeron y se destinaron más fondos para acelerar la producción y la investigación en estas vacunas. Pero es una tecnología que tenemos 30 años de conocer y que completamente segura.
Next slide, please. We also are very much aware of all the ingredients are in the vaccine. So all the vaccine ingredients are listed. So if anybody has ever had an allergic reaction to any of these previous ingredients, we are able to speak with the patient about alternatives. We also know that there is no aluminum, no mercury, or no food allergens in the vaccine. And so that is not something that people need to be worried about if that is a concern.
Los ingredientes de los cuales está compuesta la vacuna se encuentran listados en la pantalla. Son ingredientes que ampliamente conocemos y que si alguna persona pudiera ser o tiene historial de ser alérgico a cualquiera de ellos, que sepan que hay alternativas. Hasta el momento, la vacuna, sabemos, ninguna de las vacunas contiene aluminio y no tienen tampoco ninguna proteína de los alimentos que pudiera causar una reacción alérgica.
Next slide, please. The most common side effects are going to be the same side effects that you see with any other vaccine being administered. So most common one is going to be pain at the site of where it gets injected. People can sometimes have fatigue, headache, muscle pain, low-grade fevers. They don't tend to be severe. They are last on a typical course anywhere from 1 to 3 days. And a lot of these symptoms can be well controlled with the use of either Tylenol or ibuprofen.
Los efectos adversos más comunes de la vacuna son obviamente el dolor en el sitio de la aplicación. También se han reportado dolores de cabeza, fatiga, dolor muscular o dolores musculares generalizados. La mayor parte de la población solamente tiene de 1 a 3 días los síntomas. Ninguno de ellos llega a ser severo y en caso de que se necesitara, los síntomas pueden ser controlados utilizando bien Tylenol o ibuprofeno.
And the reason that we develop these symptoms is because the vaccine is actually triggering your immune system. So actually, when you get symptoms, that's a very, very good sign that your immune system has been appropriately activated. So that doesn't mean that if you don't get symptoms from the vaccine that it's not working, but we definitely know that those patients that do get symptoms after the vaccine, their immune system has been very much elicited. So it's working. Your immune system is doing what it was meant to do.
Los efectos adversos que obtenemos son la muestra de que el sistema inmune está reaccionando a la vacuna. No significa que aquellos que no tienen una respuesta es porque la vacuna no esté funcionando, solamente las personas que tienen cualquiera de estos eventos adversos o cualquiera de estos síntomas, podemos asegurar que la respuesta inmune está presente.
Next slide, please. So one of the other questions that we often get asked is, why should we get the vaccine if there's a 99% survival rate if I get the COVID infection? And although that may be true, what people need to take into account that the only thing, death is not the only thing that we're trying to avoid with the COVID infection. We have seen the COVID virus cause a lot of secondary damage to our heart, to our neurological system, as well as to our lungs. And so we, what would you translate that?
Una de las preguntas más comunes es ¿por qué debería de vacunarme sabiendo que la tasa de supervivencia puede ser de hasta un 99%? Y las razones para eso es no solamente para evitar la enfermedad o para evitar morir de la enfermedad, sino que lo que hemos observado en este último año son las secuelas que lleva el haber padecido la enfermedad, que hasta el momento se pueden identificar problemas en el corazón, problemas en los pulmones o problemas del sistema nervioso en general.
Next slide, please. Now we know that of all the patients that are infected, 30% enough will have severe symptoms that will require hospitalization, but you don't have to be hospitalized in order for us to see some of these side effects that we are seeing. Unfortunately, even in young kids and young adults, we're seeing damage to the heart muscle. In fact, there has been studies out of the military academies where our cadets are getting infected and are unable to return to training because of the damage that the infection has had on their heart. In addition, even people who have had mild symptoms, if we get chest x-rays on them after the infection has cleared, we are seeing damages in different parts of the lungs secondary to the infection. And so these patients will continue to suffer from shortness of breath and decreased exercise tolerance. We have patients who are having seizures, strokes, and this is not just in our elderly population, but even in our very young population. And so these are the type of things that we want to make sure that we are avoiding by being able to vaccinate people. It's not just death that we're trying to prevent, it's also the damage to the heart and the lungs and the brain that we are seeing.
Un 30% de los pacientes que son infectados por el virus requieren hospitalización, pero no necesariamente los pacientes que son hospitalizados son los únicos que presentan estos síntomas severos. En un estudio con la gente de la milicia, los militares, se ha demostrado que cadetes que padecen del virus, incluso cuando no necesitan hospitalización, han padecido problemas cardíacos, problemas en los pulmones o problemas neurológicos, que incluso en los problemas cardíacos evitan que ellos puedan regresar a realizar su entrenamiento o realizar su trabajo como normalmente lo hacían, como un efecto secundario de la infección con el virus. Y esta es una de las razones por las cuales la vacunación se está promoviendo para evitar que, aun y cuando no tengas la hospitalización, tampoco padezcas de estos síntomas severos.
Next slide, please. And so what we're here to do is urge anybody who has access to the vaccine to get vaccinated as soon as they can. If it is time for you to get vaccinated and somebody is able to give you the vaccine, please take advantage of that opportunity. The faster that we can get the community vaccinated, the faster that we can get back to some type of normalcy in life. The other thing that I would like to point out is that although this vaccine came onto the market fairly quickly, it did not skip any of the steps that medication is required to go through in order to ensure that it is safe and it is effective. It still went through all of the same protocols that any other medication goes through with the FDA. It just did it at a faster rate because of the urgency to get this vaccine out into the community due to the high amount of people that were dying.
A manera de resumen, esta es una invitación para que toda la población que tiene la oportunidad y el acceso a la vacuna venga y sean inmunizados. Es importante mencionar que aun y cuando la vacuna salió más rápido de lo que usualmente salen las vacunas, ninguno de los pasos en el proceso de aprobación, tanto en investigación como durante los estudios clínicos, se omitió. Entonces, la vacuna es segura, la vacuna actualmente está disponible y lo que estamos buscando es lo más pronto posible regresar a la normalidad que teníamos antes como sociedad y como comunidad.
And that does conclude the presentation, but we would like to open it up for any questions that people who are out there listening might have.
Con esto concluimos la presentación, pero queremos dar la oportunidad para todos aquellos que tuvieran alguna pregunta o que quisieran revisar alguna parte del contenido para que los podamos escuchar y resolver sus dudas.
Thank you, Dr. Gonzalez, and we do have some questions. There's a couple that we'll be able to answer, pero we will have questions that will need your help. Sí tenemos preguntas y unas preguntas que vamos a poder tener respuestas nosotros, pero también vamos a necesitar la ayuda de la doctora González. Ms. Thompson?
Yes, thank you. And thank you, parents, for sending questions, and please continue to do so while we have the privilege of being with Dr. Gonzalez. First question is, will SAISD provide transportation for students? What paperwork is needed? We will provide transportation for students if it's going to be scheduled for this week's clinic on Thursday. We will likely have students picked up at about 3:15, 3:30. No later than 4 o'clock. It'll be close to the end of the school day, but we're more than happy to provide that transportation. And the information that you'll receive tomorrow from your campus principal will give you specific instructions about what you need to do to make sure that we know that your child is going to ride the bus. And if you or a family member also wanted to ride the bus, that's certainly fine too. We just need to know that. But you'll get instructions in the information that's sent out to you tomorrow. And then for future clinics, we'll also continue to provide transportation. There was also another question about how soon can younger children receive the vaccine? And I'll respond by saying that as soon as the vaccine's available, we'll start making these opportunities available as well by continuing to partner with some of our medical providers, such as STAMP, University Health. But Dr. Gonzalez, do you have anything that you could add to that in terms of when you anticipate that younger children may be eligible?
Yes, so Pfizer right now is already seeking approval for us being able to use the vaccine in the 12 to 15-year age group. In addition, both Moderna and Pfizer are undergoing clinical trials right now for kids 6 and up. So Pfizer should probably be getting the approval in the next 2 to 4 weeks, so it's right around the corner, and then Moderna should follow soon after.
Actualmente Pfizer se encuentra buscando la autorización para todas las personas de 12 a 18 años y Moderna y Pfizer ambos están utilizando los estudios clínicos para probar la población de los 6 a los 12 años. Entonces, el estimado es que en las próximas 2 a 4 semanas Pfizer puede obtener la autorización y Moderna muy cercanamente, a lo mejor en las próximas 2 o 3 semanas igual, obtenga la autorización también.
Next question is for you, Dr. Gonzalez. Is there any medical reason for a child not to get the vaccine? For instance, if a child has seizures or epilepsy?
There is no reason for a child with epilepsy or any other type of disorder that actually puts them at higher risk for side effects to not receive the vaccine. Right now, the only contraindication to receiving the vaccine is being allergic to any of the components inside the vaccine. And even if you are allergic to the components inside the vaccine, there are ways for an allergy specialist to try to administer the vaccine for you. but the only contraindication currently is if you are allergic to the actual ingredients in the vaccine. And that would be the only reason to not administer it to anybody.
Epilepsia o de algún desorden, ataques epilépticos, no tienen ningún riesgo agregado y no está contraindicada la aplicación de la vacuna. Lo único que médicamente crea una contraindicación a la vacuna es previamente un conocimiento de alergia o de reacción a cualquiera de los componentes de la vacuna. Y aún en ese caso es posible que mediante la ayuda de un especialista en alergias, con tratamiento previo se pueda aplicar de manera segura para los pacientes que pudieran ser alérgicos o que pudieran generarle alguna reacción a los componentes de la vacuna.
Next question, Dr. Gonzalez. Will teens experience any of the same reactions as adults from the second dose, to include muscle aches, chills, et cetera, or do teens typically not experience these based on your experience?
So what we are going to expect to happen, and this is normal. So if you think about young kids, their immune system is actually a lot more efficient and a lot more robust than adults. And that's a good thing. Younger kids, younger patients are able to mount a response to any virus a lot quicker than an adult would. Because of that, then they are going to be more efficient at making antibodies to the vaccine, which, like we talked about previously, will mean that they will get symptoms. So we actually expect to see symptoms like fever and muscle ache occurring more common in our younger population, but this is actually a good thing. This means that they have a healthy immune system and that they're building the proper response. In contrast, for those patients that are over 65, we tend to see less side effects because their immune system is not as robust as somebody who would be younger.
Dado a que el sistema inmunológico de los pacientes más jóvenes es mucho más robusto y es mucho más eficiente a la hora de producir los anticuerpos, lo que esperamos es que en esta población, entre los 12 y los 16 años, puedan presentar los mismos o quizá más efectos como fiebre o dolor muscular, porque esto significa que la vacuna está funcionando. Y de vuelta, es algo esperado, dado que la población más joven es la que mejor forma tiene, la que tiene el sistema inmune con mejor forma. Entonces, esto nos indicaría que la vacuna está funcionando. En contraste con la población mayor de 65 años, que usualmente suele tener menos efectos adversos, precisamente por la misma razón, que el sistema inmune no es tan activo, no es tan robusto y no es tan eficiente. No significa que no produzcan los anticuerpos que les darán la protección con la vacuna, solamente que entre más joven es la población, mayor es la producción de anticuerpos y eso es lo que puede hacer que los síntomas sean más fuertes o que se sientan más fuertes.
I do want to, though, reassure the parents out there that just because they may have more symptoms, it does not mean that they are infected with the virus. Please remember that this vaccine cannot give you the coronavirus, so that is not what that would indicate. And just as we would treat anybody with Motrin or Tylenol to help with the symptoms, we would do the same thing with younger kids to make sure that we keep them comfortable.
Quiero reiterar a todos los padres allá afuera que nos están escuchando que el hecho de que cualquiera de sus hijos tenga una reacción que esté exacerbada o que esté un poco más exagerada en cuanto a los síntomas, eso no significa que sean infectados por el virus. La vacuna no los puede infectar. El virus nunca llegará a su cuerpo y esto que nosotros observamos es solamente el resultado del sistema inmune respondiendo hacia la vacuna. Y de igual manera que haríamos con cualquier otra vacuna, el tratamiento se da de manera sintomática con el Tylenol o con el ibuprofeno para prevenir que estos síntomas produzcan o de alguna manera incapaciten a los niños de poder hacer sus actividades.
The next question is about whether or not SAISD will offer any of the 3 vaccines, and if so, will parents know in advance? And the answer to that is we'll always let you know as parents which vaccine we're going to offer, because it's dependent on the vaccine that's made available to our medical providers, but you'll always know in advance. Mr. Martinez, do you want to?
Sí, para una pregunta que tenemos de nuestros padres, si los padres van a saber cuál vacuna vamos a dar o vamos a ayudar a nuestra comunidad para que reciban, y la respuesta es sí. Y la vacuna que esté lista para nuestros partners de UNH o de STAMP, siempre nos dicen cuál van a tener y nosotros vamos a avisar a los padres. Y también para los padres que sepan que padres que necesitan ayuda, porque estamos usando nuestros camiones para llevar los estudiantes y los padres, eso también, esa ayuda es también para la comunidad y para ustedes.
The next question would be ours as well. Is this opportunity for in-person students only, or will remote students also be able to participate? And the answer is we want all of our students to participate. So any student that's eligible, certainly we want to extend that opportunity.
La pregunta que nos parece es que esta oportunidad para recibir vacunas es para estudiantes en persona o también para estudiantes que están aprendiendo de la casa, y es para todos nuestros estudiantes. Así que queremos que todos los padres que quieran tener la vacuna para sus niños que de 16 y arriba, si están ahorita en persona o si están aprendiendo de la casa, esta oportunidad es para todos nuestros niños.
Next question is about pre-registering. Do I need to pre-register online, or do I just take the form to Pfizer if I attend that one next week? The process will vary depending on who's sponsoring the clinic. For instance, if you wanted your child to attend the clinic this week that's being sponsored by STAMP, then you're going to just pre-register online with a link, accessing a link that we'll send you tomorrow through the high school principal. If you're going to have your child participate in the clinic that's scheduled for next week at Pfizer, then you'll fill out the forms and send them back through your child's principal, or you'll take them to the site on the day of the clinic. And then for other future clinics with University Health, there's generally an online registration process. We're trying to make this as simple as possible and to even give you some flexibility about the time that you choose to go.
Pregunta de sus padres es si tienen que registrar adelantados para recibir la vacuna. Y eso depende con quién estamos trabajando. Por ejemplo, lo que estamos haciendo con la doctora González y STAMP, van a ver un link que van a recibir nuestros padres trabajando con el high school donde va su niño, y con ese link pueden ver la información y pueden ir a recibir la vacuna. Tenemos otros instancias donde se tienen que registrar, pero toda esa información puede recibir con su director y su high school. Queremos hacerlo fácil para nuestros padres, y hasta tenemos muchos tiempos para que acomodar el tiempo que nuestros padres puedan ir. Pero queremos que todos reciban sus vacunas y por favor, nomás trabajen con su escuela y pueden recibir toda la información.
And while we're waiting to see if there are any more questions, Ms. Martinez, would you go on and restate what I mentioned about bus transportation being provided?
Sí, queremos otra vez repetir que para todos los estudiantes y padres que necesitan ayuda, estamos usando nuestros camiones y pueden accesar nuestros camiones para que los lleven y los traigan para atrás para que puedan recibir sus vacunas.
Those are all of the questions that we have right now, unless there are any others that are coming in.
So I want to just, again, thank you, Ms. Thompson, for being our leader here in the district, helping us with both COVID testing and vaccines. Dr. Gonzalez, thank you so much for the partnership we have with you. You're just an amazing leader to have in our community as an expert as you help us navigate this. Tengo muchas gracias para la doctora González porque ha estado con nosotros ayudándonos, es un líder y un expertista en ayudándonos con este pandemic, y también a la señora Thompson, que es parte de nuestro distrito, que también ha estado manejando todo lo que estamos haciendo con exámenes de COVID y también ayudando a la comunidad para recibir vacunas. Gracias por estar con nosotros. Thank you, parents, for being with us. Please get vaccinated. Make sure you work with your high school. We want to have your children get vaccinated as well as you getting vaccinated so that we can hopefully come back to where we were at before this pandemic hit us. Para nuestros padres, quiero que reciban sus vacunas, por favor, para ustedes y para sus niños. Queremos que, para que todos estén seguros y podemos hacer las cosas que hacíamos antes del pandemic. Gracias y buenas noches. Thank you. Good night, everyone.